Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Saiti Alapati from Apollo Cradle and Children's Hospital. She is going to talk about HPV vaccine. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Yeah, hi. Hi, everybody. I'm here. I'm Dr. Sahiti Alapati. I'm from Apollo Cradle. I'm here to talk about cervical cancer and HPV vaccine. Sorry, one second. Yeah. So, cancer cervix, which is often referred to as the silent killer, it's almost 100% preventable. Most common cancer for this most common cause for the cervical cancer is HPV. What everybody knows as HPV is nothing but human papilloma virus. It's actually a virus which is causing this cervical cancer. It's 100% preventable. So when it is a virus, we obviously have a treatment for it, right? So we do have a HPV vaccine, a human papilloma virus vaccine. This vaccine, it prevents cancer in almost all cases, provided it is taken at a very early stage, and that's when it helps a lot. So these are some of the pictures. That's how it looks. HPV, it causes cervical cancer, it causes genital warts, it can affect the skin, throat, and genital area and all these places. So cervical cancer, it's one of the deadliest cancer and most common cancer in India nowadays. A woman loses her life to cervical cancer battle every 9 minutes. So make sure it's not you or your daughter or your son. I mean, son, obviously not cervical cancer, but penile cancers and all those. So, um, why talk of a cure when you can prevent it is one thing we have to remember. So, what is it? What exactly is HPV vaccination? It's the first step of cervical cancer prevention. Remember one thing: cervical cancer, when detected at a very early stage, is 100% curable. So, we don't really have to lose anybody to cervical cancer. So, HPV vaccination. So, what exactly does HPV cause? It can cause oral, cervical, penile, vulval, anal, as well as vaginal cancers. So, this HPV vaccine, it prevents against cervical cancer and all the other cancers also, which is caused by HPV virus. So, what is this HPV vaccine? How many different types are there? We have Gardasil 9, which is the most recent one that we have come up with, and then we have the Gardasil 4. So Gardasil 4 prevents against the four most common strains of HPV virus, and Gardasil 9 prevents against 9 different strains. Yes, there is a cost difference between both. Gardasil 9, each dose costs about 10,000 rupees. So now, what is the schedule for HPV vaccination? The schedule, when taken between 9 to 14 years of age, is nothing but it's a two-dose schedule. The first dose and the second dose, which is given 6 months later on. And after 15 years of age, up to 45 years of age, it's a three-dose schedule. The first dose, second dose, which is given after 2 months, and the third dose, which is given 4 months after the second dose. So totally, it's a 6 month period. That's how it goes. So if you're going for Gardasil 9, it is expensive. I do accept that, which is it protects against 9 different strains of HPV virus, which are known to cause different carcinomas. But each dose costs about 10,000 rupees. So totally, when it goes to 3 doses, it's about 30,000 rupees. Whereas if you're going for Gardasil 4, each one will cost you around 4,000 rupees. So totally, all 3 doses together will come around 10,000 rupees. So this is just a formula to show this. So, the earlier we are immunized against HPV virus, the better is the benefit from this virus, from the vaccination, and we can protect ourselves as well as our children from the virus. That's the reason we advise everybody to get vaccinated and to vaccinate their children as early as between 9 to 11 years of age, both girls as well as boys. So this is the same slide which we are showing, which shows the different doses and different age groups. So HPV vaccine, it's a very safe and highly effective in preventing cervical cancer, as I said before. Yes, so challenges in HPV vaccination that we are facing nowadays, it is expensive. We do have multiple doses. And right now, India is coming up with with their own vaccine. Gardasil and all this are from USA, but India is coming up with their own vaccine. It's called a Cervavac. This is not as expensive as Gardasil 9. It's anywhere between 2,000 to 4,000 rupees. It's an indigenous vaccine, which is being produced by our own country. So, as I said, the HPV vaccine, we have the Gardasil 4 as well as Gardasil 9, the quadrivalent as well as the nonavalent vaccines. That's how it is. So, how do we protect ourselves against cervical cancer? Yes, it is 100% preventable, and we can protect ourselves by getting a pap smear done every 3 years, right from the time of sexual intercourse. Every 3 years, if you're getting a pap smear done, we can detect cervical cancer at a very early stage. Supposing we are going for a pap smear as well as we are going for a HPV testing, then it is done once in every 5 years. That's how we do it. Now, why exactly are we vaccinating all our sons and daughters as early as 9 to 11, 9 to 14 years is because menarche usually we attain around 13 years of age. So, if we are preventing ourselves by protecting ourselves from HPV virus even before we attain menarche, then it is more effective because every person who is sexually active at some point in their time, they will get HPV virus. They will be affected by HPV virus. Usually, our body is strong enough to clear this virus within a couple of months. But then, if our immune system is weak, or if the person is a smoker, or there are other things like this, then the virus can be there in our body for a longer period of time. And when it is a persistent virus, it leads to cervical cancers. So, to protect ourselves, we have to get a pap smear done once in every 3 years. And if it's pap smear with HPV testing, then once in every 5 years. So, do we have any questions as of now? So, when we go for the questions, who can get a HPV infection? Anybody who is sexually active can get a HPV infection. And what is the best way to prevent cervical cancer? Is to protect ourselves by taking the vaccination as early as possible. And how safe and effective is the HPV vaccine? It's 100% safe. No problem at all with this. Does the HPV vaccine have any side effects? Yes, side effects you can have mild symptoms like pain at the site of injection, feeling a little feverish, few joint pains. That's a maximum we can expect from this. How many doses of HPV vaccine are needed? If it's before 15 years of age, we are initiating vaccination. Then it is 2 doses. The first dose and the second dose after 2 months. If it's after 15 years of age, up to 45 years, it's a 3-dose schedule. First dose, second dose after 2 months, and the third dose 4 months after the second dose. So totally within a gap of 6 months. And supposing somebody forgets a dose, then it's advised to take it as soon as possible, but not less than 4 months after the second dose. And there is no need for a booster at any point of time. HPV vaccine, this is centered mostly around HPV virus that is causing the cervical cancers. So, what are the symptoms of cervical cancer? Symptoms of cervical cancer, it can be anything, growth on the cervix, which we really cannot feel, but we can see when we go for a gynecological examination. And symptoms such as watery discharge, which is foul smelling, and bloody discharge. All these are signs of cervical cancer. Can cervical cancer be treated? Yes, it's 100% treatable, provided we are detecting it at a very early stage. So many people who come to me who are pregnant, they ask me regarding HPV virus and the HPV vaccination. So in pregnancy, not advisable to take the HPV vaccine. We can take this after you're done with your pregnancy. Supposing you conceive at the time of taking the vaccine, this is not an indication for going for a termination of pregnancy. You can continue with the pregnancy. And supposing the third dose is left over, you can take it after your delivery. You don't have to take it during the 9 months. So, who should get the HPV vaccine? Everybody, all young girls, all young boys, everybody between 9 to 14 years of age, you should take this vaccine. And if children have missed it at that 9 to 14 years of age, and if they're above 15 years, also up to 45 years, we can be vaccinated, but it has to be a 3-dose regime at that point of time. So yeah, I hope I'm clear on HPV vaccination. I hope everybody has understood what I'm trying to, the message that I'm trying to pass on. I can answer any questions if somebody has any questions.
Wait, it's even.